I would now like to pass you across to Mark Wright.
So look, thank you so much. I'm glad to be here today, and I've actually got some special guests. So I'll be introducing Beck and Joanna in a moment. And I guess very excited today to be able to share with everyone a lot of our learning around the Health and Safety Index and hopefully how that can help your organisations with whatever your goals are. So I'll continue on and just provide a really quick overview of what we're going to cover today. And we've got a couple of little polls there too, Sarah, so hopefully they're all set up and we can get some feedback from those who are online today. So we'll share a little bit about our organisation, reflect on what your needs are so we can cover those off today. The title of today's presentation is an integrated approach to health and safety. And I emphasise the word "and" because a lot of organisations may look at health and safety in isolation. So today we'll talk about some of the benefits of that integrated approach and looking at both those areas at the same time and what that might mean for you. We're also very excited to share some benchmarks. We've used the Health and Safety Index and received feedback from thousands and thousands of people. So I've got a really good industry benchmark to be able to share with everyone today so people can learn from, I guess, some of our experiences and what people are saying across many other organisations. Lastly, we'll have some final takeaways, a bit of a summary and a few tips and tricks on what that might mean for you. So Sarah, are you in a position to be able to help us with a poll today? Great. Okay. So for those people who are involved, we'd love to hear what you'd like to understand about the Health and Safety Index today. So 4 options there to select information around survey reliability and design principles of surveys, health and safety research, the industry benchmarks that we're using with the Health and Safety Index, and lastly, any practical takeaways. So Sarah, I'll be guided by you on when you believe those results will be ready and we can present those back to everyone. Great. So as we're waiting for those results to come through, it's probably worth mentioning when we completed this survey last time, it was very insightful to just get some feedback from everyone to understand what some of their goals are and what they wanted to get out of the session. That allows us to help tailor the message, albeit probably a little bit impromptu. We'll do our best to be able to cater for the audience's need today. How much longer do you think we'll need there, Sarah, until we think the poll will be finalised? So I can't see them myself. Perhaps you might be able to give us some guidance on whether or not others can see them.
Sure there, Mark. Alistair here. So we have got 43% of people are looking for practical takeaways from today. We have 28% looking for the Health and Safety Index benchmarks and 20% looking for survey reliability and design principles, leaving 9% on health and safety research.
Okay, fantastic. Well, look, with that in mind, I think it's great that we've got both Beck and Joanna here today. Both Beck and Joanna have used the Health and Safety Index. I'll introduce those to people in a moment, and I have no doubt they've got lots and lots of learning that they can share with everyone today on practical takeaways. So quickly, just a little bit about us. I won't bore you to death with all the work that we've done over the last couple of years. What I will say is that Fifo Consulting has been around for a few years. The Health and Safety Index turns 1 in about 10 days. So we're going to have a bit of a birthday celebration, which is great. We do have a bit of a team scattered around most of Australia and key capital cities. And if you'd like to hear more about our mascot, Milo, my daughter's dog, he also has a profile on our website and is a key member of our team. So feel free to go and check out a little bit more about Milo's experience and how he helps our team as well. So, so Beck and Joanna, how about I hand things over to yourself, and you can explain a little bit about your roles and what BSA do.
Sure, no problem. So I guess with the feedback on practical application of the index, just to give some, I guess, overview of BSA, we're a technical service company and we work in HVAC and mechanical work. We do fire service work and a lot of work in the communications and in utility industries. So I'm head of safety across the business and work pretty closely with Joanna, who's head of people. So hopefully we'll be able to provide you with some insights on what the index has meant for us and what our experiences have been throughout the process.
Great, thanks, Beck. And just to help everyone on the line today as well, in terms of some practical takeaways, even before completing the Health and Safety Index, are you able to share with people, I guess, some of the reasons why you decided to use the Health and Safety Index in the first place?
I guess being a service industry, being able to have a benchmark for us to have targeted actions. We're a pretty nimble business, so it meant that when we've got a budget, we've got to actually be really targeted in what we do and initiatives when it comes to sort of health and safety. And one of the other interesting factors, particularly on the index, was I guess the emerging risk of health and wellness and mental stresses in the workplace was a real in the last sort of 12 to 18 months, particularly around COVID. So I was really interested to have some sort of survey or some data to talk to be able to target programs. So if it meant that we wanted to target programs on sleep, that were actually with data and investing in the right areas rather than investing in drug and alcohol programs where sleep's just the real issue. So that was one of the benefits that we were really looking for to build what our program would then look like. Tangible information.
I think the other thing for us is that we largely have a dispersed workforce who work out in the field, and it was a good opportunity for us to be able to collect feedback from that workforce, to hear from a health and safety, but an overall experience of what it's like to work for BSA.
Yeah, fantastic. Okay, well, look, as we go through today, I'll be asking both Beck and Joanna lots of questions, hopefully not putting you on the spot too much, but given that a lot of people would like to hear some practical takeaways, I'll try and introduce some of the concepts and just hand things back to the BSA experts who have actually used the tool recently. Sure. No pressure, Beck, of course. So just a quick intro to the Health and Safety Index for those who don't know what the index covers. So the Health and Safety Index covers 4 key aspects. Safety leadership, so looking at individual behaviours. Safety engagement, so predominantly organisational factors influencing health and safety performance. Safety systems, so not so much an ISO audit, but more around user experience and access to the right resources. And then, as Beck sort of mentioned, health and wellbeing, particularly a focus on psychological risk factors. We also slice and dice the data by 7 dimensions, and we can go through those in a little bit more detail in a moment. Most of those are focused on behaviours, given the impact or potential impact that they have on organisations. And the 7th dimension is on conditions and experience. So the environmental conditions, people feeling psychologically safe, and some of those more physical, tangible things in terms of access to the right plant and equipment and usability of systems. So a lot of people do a typical either climate survey or some form of employee engagement survey, and often they get to the end of it and they say, yeah, so what? Where do we go? What do we do with the information? So apart from engaging your key stakeholders on that, we've also provided guidance, which is basically a bunch of correlated information that provides people guidance on how to act and to get the best return on their investment as it relates to their specific results. So Joanna and Beck, is there any information that you wanted to talk about as it relates to what the Health and Safety Index covers?
For us in when we reflect back now that we've done the work, that you talk to, they're already fairly aligned with what our safety strategy was for our business. But what we've been able to do now, as we look into FY22 and beyond, is really align all of our initiatives on that those 4 aspects. And in fact, that's what it looks like now for us. So that it means that when we're having conversations amongst the safety team or operationally, we're all sort of now talking the same talk, and it means that we've actually now got index rates that actually talk to each area, and we can invest in the right spaces to drive that continuous improvement.
Yeah, and I'd add to that what it's given us is a common language. So we've now got language that we can talk to each of the aspects.
Yeah, great. Okay, fantastic. Look, hopefully we can get into a bit more detail on what those things were as we go through today. A little bit more about why the Health and Safety Index is unique. Look, I won't go through everything that's on the slide. I'll just highlight a few key points and perhaps ask Joanna on your experience around some of the engagement piece. One of the unique things about the Health and Safety Index, apart from it covering off those broader holistic areas that we've spoken about already, is that it has been validated through an organisational psychologist, a PhD out of Murdoch University. So what that provides is an excellent reliability and confidence that when people are doing the survey time and time again, that they'll get relatively consistent results in the same circumstance, and it allows them to provide them with a solid benchmark to make comparisons over time. We also can integrate demographic data. So apart from looking over the fence and providing some sort of external benchmark and comparison, organisations get a lot of benefit to inform their strategy around differences between different cohorts, be it geography, division, gender, age, etc. From an engagement point of view, some organisations often use employee engagement surveys. They don't necessarily always have the same level of focus on health and safety. We've created this health and safety with engagement, general employee engagement questions integrated into that. So I guess, Joanna, from your perspective, given that you're the head of people and all things HR at BSA, how have you used some of the outcomes, particularly around engagement questions, as it relates to some of the strategies that you may deploy at BSA?
For us, the information was very valuable, as Beck said. It helped validate other information and feedback from other sources that we use as well, etc., and other data and metrics. So it became another rich source of information that we knew where I suppose our workforce had been given an opportunity to provide confidential feedback, which meant there's reliability, being honest feedback. It helped pull it together and us to be able to use it to target actions and then work with Beck and the team around having actions that then, I suppose, brought us together, that it's one for our employees, whether that be from a safety perspective, a wellbeing perspective, or a general engagement. The other thing that was very valuable to us from an engagement perspective was being able to check in around, is the feedback we're hearing support values that or are we seeing in that data and results information that's telling us we've got some work to do in some of those areas, which we're able to do as well through the focus groups.
I think
fantastic. And
the positive experiences out of it was being able to slice the data and look at whether we have a cohort of issues in Queensland, for example, that relates to health and wellness, or whether it be actually the vision that we've got some leadership initiatives that we then need to, but we could actually be really targeted to different areas in the business. And I think that was one of the positive outcomes of it, is that we're now able to actually target into those sort of areas. And then the leaders can then own that, so they know where their issues are and they know where their hotspots are that they've got to work through.
Great. Okay, thanks, Beck. And I think it's also fair to say that many organisations, through no fault of their own, often have different departments, divisions, or even functions that sometimes work in isolation. And I think it's great to see both Beck and Joanna are actually in the same room talking about these common goals. Too often you see either safety and or other functions within the organisation not collaborating effectively. And as you can see on the screen here, by working in isolation, you often lose that value creation of not only collaborating, but working towards common goals and coming up with solutions together. And as you listen to Beck and Joanna today, I think it's just great to see the level of involvement, and I've no doubt that'll resonate in some of the results that you're having as well. So as it relates to BSA's experience, either Beck or Joanna, I mean, apart from looking at health and safety and HR, do you have any other practical takeaways or learning or experiences where the health and safety index may have impacted on other functions?
I think for and you're stealing my thunder on the next slide, Mark, but what it actually did was actually bring our executive leadership team together. So we're structured so that we've actually got heads of each kind of functional areas, but what it did was together and it almost became an anchor back, and it became then the conversation piece that we could go off on a tangent, but it gave that common thread now, and particularly because it's not like Joanna and running their own sort of engagement surveys, and then we're running a safety one and we're getting different results, and then we're challenging each other. That was certainly not experience and not how we operate, which is, I think, for us is why that this tool will be successful. A number of initiatives, because it did come together and did provide them that common experience for our workers, and it wasn't for us just another survey, give us some more feedback. It really, there was a lot of meaning behind it, and I think because, Mark, you've invested research into getting the metrics right, then gives us the quality that we're looking for, and it's not sort of too over the top. You could probably spend, I think, a couple of months going through the data sets and looking at them different way. Every time I pick it up, I find something different. So you kind of, for us, just walked away with, okay, what are the two things we're going to do in each area now, and what are we going to, and there's some common ones that Jo already had on her radar that just sort of validate, okay, let's just go with that one then.
And we saw pretty quickly that it just didn't make sense to, it would have been overwhelming to the business to have different initiatives coming for different purposes, when, as Beck said, the tool gave us an opportunity to anchor back to some data and some information, and it played across both of our strategies and plans. And it made it easier to translate that as a common set of activities across the business and across then the experience of our workforce.
Fantastic. Okay, well, look, I guess the other thing worth mentioning from my experience in working with other organisations too is that it has helped inform some strategic choices as it relates to investment and finance. It has helped understand the supply chain, particularly contractors, and their performance, as well as working across broader organisational risk, and as that might relate to both threats and opportunities for the organisation, both internally and externally as well. So, Beck and Joanna, I know you've already shared a few of your experiences already. So based on the slide now, it provides a bit of a summary of, I guess, your experience. Is there anything else that you wanted to add as we start talking through this slide too?
Yeah, I guess when we reflected on what our experience was, we did sort of look at it as being the voice of our people, a collaboration tool, and then gave us some targeted action. So from the voice of our method or way for us to get that honest feedback from our people, and that translated for us then into some scores, so we can slice and dice the data in a number of different ways, but can't argue with the data and with the feedback, which provides some really valuable conversations. And then for us, I think it did extend then beyond the traditional health and safety function with that alignment with the people team. I certainly have worked with HR professionals previously where it just was just that real challenge consistently, and that's just not the experience that we've had now. It has really brought us sort of together.
And from the outset, you know, we sort of Beck reached out right and a lot of the planning and for launching the survey and what we did with communicating the results. We talked about that and collaborated on that together so that the language again was consistent and felt like a BSA activity rather than a safety-owned initiative.
So I guess from a collaboration perspective, that gave us the common language we keep talking about, because it really does now, and it will. Experience now has been, and I keep reflecting on a moment a couple of weeks ago where we were in a senior executive management team, and I was presenting trends and lead and lag information and traditional safety performance information. The conversation started to go off on a tangent, and one of the EGMs said, "Hey, hang on a second, the index said this, our measurement is here, so from a systems perspective we need to actually look at this." So for us now, our experience is that we're actually going to keep getting drawn back into and it actually keeps us honest in the direction that we're going, so that we are quite targeted.
And I think that what we've also seen is the collaboration is extended beyond the executive leader. The teams beneath have taken the results for their different areas and are working together with what's next for them and their action plans, etc.
So I guess, and ultimately what that then gives us now is a clear, as I said, set that 12-month roadmap now that says what do we want to achieve this year, and we will plan to then resurvey in February next year to sort of, I guess, ensure that our approach and our method worked and our were hit the mark. One of the other things that we did do throughout our implementation plan was make sure that our communication plan at the outset, so it came out from our CEO, and there was regular communications, and now what that will look like is that we'll go and validate in some consultation groups our response or our action plans will be, and there will be then our senior management team will then flow on through with their communications about what they found, what they're doing differently, and what they're doing with the information.
Yeah, brilliant. Well, that's awesome. I mean, I get so much gratitude out of listening to organisations not only use the tool but get some real value out of it. So music to our ears, and our team's really pumped to know that it's adding value. So as we go through today, I'm also mindful that the audience also wanted to hear about some of the benchmark data. So we'll skip through to the next slide. We'll just take a quick survey first, just to get a bit of an understanding of the experience of people on the line as well. Sarah, are you in a position to be able to run another poll for us?
Poll has started for you, Mark.
Fantastic, thank you. So for those involved, in the last 12 months, has your organisation completed no health and safety survey, which is quite common? There's no right or wrong answer. Have completed a survey that's just focused either on safety climate or as some people call safety culture. So that's just safety, as opposed to question C, a health wellbeing survey, and D being both health and safety. So looking at both health and safety aspects to their organisational performance. So I can't see the results myself, so I'll be reliant on Sarah and the team there to give us some feedback on how that's going.
Yeah, Mark, so we had fantastic, we had 70 folks respond to that one out of 110, which is great. So we had 39% with no health or safety survey, followed by 26% with a combined health and safety survey, then 19% with a health and wellbeing survey, and 14% with a safety climate culture survey.
Okay, really interesting. Really interesting. And as I say, there's no one or right or wrong result, but just really interested to understand people's experiences. And you know, certainly we've got a view on what we believe works the best. But again, every organisation is different, and using any of these mechanisms, either surveys or other means to get feedback from your stakeholders, certainly can't do any harm at all in terms of getting feedback and informing the best approach to improve.
I think
so as we start looking at some of the results, again, this could be really interesting for people on the line. The results here are not BSA's results. These are a collective of thousands and thousands of responses across many organisations, and we've provided a bit of an average, if you like, of what those benchmarks look like in a typical format that a health and safety index report would be provided. We certainly aren't going to share all the data. We just don't have time today, but just a quick snapshot. We've got about 10 minutes left, and I'm also mindful that we've got about 5 minutes of Q&A. So I'll quickly go through, I guess, what a typical dashboard would look like. We've spoken already around how the data is sliced and diced into one index, 7 dimensions, the aspects there. I guess as it relates to some of the results, it's probably worth mentioning that we've got both input questions and output questions, and trying to understand how that data relates to each other is really important in terms of how we interpret and provide feedback to organisations. So often we're seeing certain questions or behaviours and results, and that could be a question around holding people accountable or observing colleagues walking past unacceptable behaviours or taking shortcuts, or it could be around time pressures impacting on health well-being and also impacting on, I guess, people's observations around taking shortcuts. So you can see there's a huge interrelationship between some of the behaviours and the impact that has, not only in terms of the results, but the output. We've got some typical questions around the impact on engagement, the impact on adverse effects to health and well-being, sleep, etc. And I guess by looking at those things together, it does paint a really good picture for organisations to understand what's working and what's not working so well. I'll continue on, and I'll provide a little bit more detail, particularly around health and wellbeing, because it has been such a big focus for a lot of organisations over the last couple of, or the last 12 months in particular with COVID. Here are some benchmark results around, and this is what I'm saying, or my team, this is what industry is saying around what's their strongest results and some of their weakest results and the impact that's having. The research that we've used to design the survey is really based on job resource, job demands model, and the outcome or output that has in terms of the impact on individuals, groups, and teams. So as you can see, safe conditions, the ability to talk to supervisors and setting expectations are really positive results. And what I say to most organisations is try and focus on the positives, because the best vehicle for change is on what's working, and use that as a platform to leverage and work on areas that may not be working as well. So if there's great relationship with supervisors or there's great conditions, really understand how you can use the supervisor relationships with their teams to drive some improvement. Some of those lower scoring results, people feeling like they don't have a realistic time pressures, which impacts on their sense of health well-being, not having a sense of control over change, so that uncertainty around change and the management of change impacts on well-being, and the final one there, being able to talk around health and well-being, which for a lot of organisations and individuals still is a little bit taboo. The outcome is that about half of the respondents say that they either sometimes, always, or often will experience adverse effects to their health and well-being as it relates to work activity, and work also impacting on their sleep in the last month. So there's some really meaningful outcomes that organisations can use to either drive improvement or demonstrate it at a minimum to their people that they're listening and they're trying to make some genuine improvement. So Becca or Joanna, is there anything you wanted to add around your experience on health and wellbeing?
Only that the results are pretty consistent. I mean, they're benchmarks, but ours are fairly consistent. And the sleep, And that was sort of consistent with some information that we've done through some other health and wellbeing sessions we ran last year. That was a really common theme, which was sort of news to me, but kind of then validated through the index.
Fantastic. Okay, well, look, we've only got a couple of minutes, so I'm going to have to talk really, really quickly. As we mentioned, we do have an ability to integrate specific demographic data. So I guess some common demographic data that impacts a lot of organisations I've got on the screen here, and a bit of a comparison between employee and contractor data. So I guess what you're seeing on the screen here is that contractors' health and safety performance is somewhere between 9 and 24% worse compared to the general population around some specific question sets and behaviours. Not surprisingly, they often relate to the feeling to compromise safety, so putting production before safety, time pressures, getting stuff done quickly or rushing is starting to impact on their performance and their ability to compromise safety over production. So as an outcome, that often leads to not only health and safety performance issues, but also health and wellbeing as well, as we've spoken about already. So I guess in summary, the focus or the approach that we take at least is to help organisations measure their performance, analyse and focus on areas that are important. There are 11 levers. If we look at some of those lower scoring levers across the larger population of many organisations and thousands of respondents, is values and beliefs, communication, accountability and recognition are 4 key levers that organisations are not performing so well on. Because we've run out of time, I can't go through and explain to everyone what they actually mean and some of those specific behaviours and conditions. But hopefully, if people have got time to reflect on the recording and even contact ourselves after this webinar, more than happy to explain those in a lot more detail. So some practical takeaways and questions time. I'll hand things back to the moderator and happy to answer some questions.
Thanks, Mark. Yeah, so the first question up, which seems quite popular, is probably for Joe and Beck. Where are the operations people in your integrated approach?
Where are they? They absolutely are. So whilst we're shoulder to shoulder literally right now, but also in the process, we also have our 2 managers that are really close with this data as well. So our structure is that we've got them direct reports who work in with them. So
and the benefit of us working closely together with them meant that it's one set of initiatives, of course, that allow them to be able to then work with their teams rather than having different initiatives coming out of our different spaces.
Almost competing priorities.
Yeah.
So we don't have that one.
And to take that one further, I'm sensing that the question may be around influence from the ground and that voice that you mentioned there. What was some of the feedback that you got from your operations people on, people on the ground on the health and safety index?
Look, it was a really positive experience for us. We did a lot of the upfront communication. So from the outset, we undertook our survey in February. So from December, we presented it, all the senior managers, this is coming. So there was a lot of communication out there because what we wanted to achieve is maximise the participation rate so that we got some really valuable feedback. So the feedback was easy. We ran them at toolbox sessions. So we were really clear in our communication. So it was like, just log on at the toolbox meeting, give us your feedback. And then it was sort of then leader-led, I guess.
Yeah, absolutely. And then we've got now with the operation, the focus groups, which are validating the information, the survey results, etc., and the initiatives to continue that communication.
Okay, fantastic. Thank you. We've got time for one more. Again, another popular question, which is we're using survey information, but there are other methods. And Mark, this question's probably for you. What other methods of gathering data and information could you be using in addition to a survey?
Yeah, good question. So often there are a lot of inputs into reflecting on performance and developing and deploying strategy. When we work with organisations, we engage people through focus groups. We look at incident data. We look at proactive risk management strategies. We look at EAP data, workers' comp data. So a combination of different inputs, both more tangible things and anecdotal things from observations in the field and talking to stakeholders often gives you a really good picture. So doing that with survey often provides some really good insights into how the organisation's performing and what they think is important.
Okay. And there is one more question. How do you keep respondents engaged so that they don't feel that they are suffering survey fatigue?
Yeah, so we haven't mentioned in a lot of detail that there are only 55 questions. It takes about 10 minutes. Bex mentioned a lot about the communication up front and the engagement and the whole process around explaining the importance and the benefit to the end user. We also try and make sure that we provide feedback to our clients so they can provide feedback to their workforce in a timely manner. You know, if feedback's positive, timely, and predictable, often that leads to much higher levels of engagement.
Okay, thanks, Mark, and thanks to Joe and Beck and yourself for the discussion today. There are quite a few questions still in the box, and I would invite people to come join us for the networking session. We will be exporting these questions. We'll have them to hand, and if people would like to join us, there may be an opportunity to go through that question that you have in more detail on the networking session this afternoon. So thanks for joining, folks, and take care.
Great. Thank you. Thanks, Beck. Thanks, Joanna.
Thank you.